I was given two tasks. One was to summarise today and lead you into a segue into tomorrow. And the other was from Chris to extract a promise from you. So I'll come back to the promise at the end of what I'm going to say. So what of today, and what lessons and messages do we take forward? Well, Ian Jacobs started today with a challenge for Sphere, the Sphere Venture and the Sydney partnerships. That is about ensuring that no one gets left behind by advances in health and clinical research. This is also a theme embodied in Charles Day's exposition on innovation, who raised a critical question about innovative health and clinical research, which is that unless we can translate our science rapidly into our hospitals, our patient experience and our communities, then innovation in health research will ultimately be a failure. Importantly, the first panel indicated that success in this space will be dependent on the effective engagement of all of the healthcare workforce, alongside our researchers in the university sector, and most importantly, with public and the patients and the whole community participation. This panel also saw that the job of Sphere and the academic health science partnerships is to act as a conduit and curate and bring forward innovation into clinical care and healthcare systems. The rest of our speakers today, I think, have from differing perspectives and disciplinary positions all outlined some of the challenges to achieving that agenda. But importantly, all of the speakers today did not leave the conversation at the point of challenge, and all proposed a vision of solutions, underpinned, as Melissa Tate urged us, to think that all health research has to be for patient benefit. Anushka Patel inspired us to be transformative to achieve equitable outcomes from multiple interacting components via the discipline of implementation science. And Sue Van echoed this by saying that knowledge translation is not a dirty word, but that taking risks and being brave can mean that it is possible to leverage the benefits of entrepreneurial behaviours to meet the needs of the underserved and under-researched. We also debated today the challenges and opportunities created by technological innovation, the transformative potential to health by medical research in genomics and big data, which illustrated the need for our universities and education sector to ensure that the curriculum for our healthcare workforce is agile and able to respond to the technological challenges and changes created by the human genome sequencing. Education is the E underpinned in Sphere, and it's important we don't forget that element as we move forward. Overall, challenges to our thinking and ways of doing business has been very much part of today. Beautifully, the Cyborg Quartet challenged our notions about the embodied nature of performance, and somewhat I found uncomfortably questioned the ethics of control over embodied personhood. After lunch, Lisa Jackson Pulliver spoke powerfully of the absolute imperative to address the health and well-being of Aboriginal and Torres Strait Islanders. But most importantly, she identified the core lessons from programs that work. These are strength-based approaches grounded in strong community relationships. Elizabeth Koff then eloquently continued this theme, highlighting that effective healthcare policy will be grounded in a collective vision of where we are, what we can gain, and by embedding value-based healthcare into our healthcare system. Our final speakers this afternoon raised how to address the gap between research and practice. Gary Ford drew on the UK experience to illustrate how an academic health science partnership can be just that, a collaboration to improve research infrastructure and align health service agendas. Leslie Levin highlighted how a collaborative approach that untangles mistrust in evidence-based approaches can mitigate the rejection of evidence-based healthcare innovation and achieve translation into policy. Our final speakers, Martin Bowles and Helen Bevan, gave us visions of healthcare leadership that will create innovation in healthcare system and square with the needs of the population. Which brings me back to the very start of the day and the challenge posed to us by our first speakers. Now, the advertising for today made an ambitious claim. Sphere to become the Davos of healthcare thought leadership. So I will finish with a quote from Davos 2017, which I think summarises the theme of today and the conversation that we'll have tomorrow. Linda Hill, the Harvard Professor of Business, said people don't want to follow a leader into the future, they want to co-create it. Thank you.